Hi, this is Megan here, back for week 2 of our Bell's Palsy recovery series. Today, we're talking about the nerve recovery process. So, as you know, with Bell's palsy, you have the facial paralysis and the facial drooping, and that is because the nerve in your face is irritated. There are several things that we need to keep in mind when we're working on nerve recovery. The first thing is that we're not just working on the nerve, we're working about the muscles and the connective tissue in your face as well. When the facial muscles freeze in place, in that paralysis and that drooping, they can freeze in place in such a way that constricts the facial nerve, and that can be an obstacle towards healing. The connective tissue underneath also freezes in place, and it almost becomes a mask that is immovable. And so we need to work on getting those muscles to relax and break up any adhesions in that connective tissue so that they can relax and not strangle the facial nerve and give it a chance to actually heal. This principle is actually the same in lots of different other nerve type injuries, such as a neuralgia down the arm, where you're having that referral nerve pain, numbness, and tingling in your hand, or sciatica. The second thing that we need to do is to reduce inflammation. Inflammation can keep you in pain and keep that nerve very sensitive and contribute to multiple different feelings of discomfort. The third thing that we need to do is restore communication between the facial muscles and the nerves in your face. We're literally retraining these neural pathways because when the communication is disrupted, that's when you get that paralysis and drooping. This becomes more of an issue the longer that you've had Bell's palsy, but rest assured, we work on reestablishing that communication. That's a lot to do, but that's okay. It just takes time and repetition to achieve these goals. We use a lot of different modalities here at South Shore Acupuncture and Wellness to work on all of these: acupuncture, ATP, and ozone therapy, amongst 3 of the best ones to work on this. So if you're still in Bell's palsy recovery months or even years later, don't lose hope. We're here to help, and we have a lot of tools in our toolbox to help you do that.